afternoon, everyone. I'm Dr. Parag, Shankarrao, Dekate. I'm Director of Pediatrics and Head of Pediatric Intensive Care and Pediatric Emergency at KIMS Cuddles, Kotapur. Today, we are going to discuss about one issue. That condition is basically sinus infection in kids. So why it is very important is because a lot of times, though sinus infections are very common in the adults, they are not that common in the pediatric age group. And sometimes we fallaciously say that my child is having sinus infection at pretty early age, which is unlikely and which is not possible because there is a process of development of these sinuses in the body, and they can't get infected in early age group where they are not actually present. So briefly, I wanted to talk about sinuses. First of all the sinuses are not present since birth. So there are two sinuses which are present from birth. One is ethmoid sinus and one is maxillary sinus. So ethmoid sinus is quite inside this, near the eye, and maxillary sinus is basically here. So what happens is, though they are present in the early life when you are born, but they are not pneumatized. Pneumatized means it's a part of a bone, but there is no kind of an air inside the bone. The sinuses are very important for circulation. They are very important for decreasing the weight of the skull, as well as the purification of the air. So the sinuses, two sinuses, ethmoids and the maxillary sinuses are present from the birth, but usually the maxillary sinus becomes aerated or the air comes into the sinus by the age of 7 years. So very unlikely that you will have maxillary sinus infection in early ages, like 2 3 years of age, because there is no air inside the, or there is no space as such where the infection can come in. Second is ethmoid sinuses. Yes, you can have ethmoid sinus infection early because they usually get pneumatized by the age of, there is some air inside that at the birth, but slowly the air increases, and by 2 to 3 years you can have a good pneumatization. So you can have an infection of a ethmoid sinus, but it's quite deep inside, near to the eye. So unlikely you can have infection of that. And the other common sinuses are frontal sinuses and sphenoid sinuses. Sphenoid sinuses are inside the kind of a skull near the brain. They are usually develop around 3 years, sphenoid sinuses, and till adult age group they get pneumatized. So unlikely you can have a sphenoid sinus infection. And frontal sinuses infection, usually we see it in the adults. They get they are actually start appearing by 3 to 6 years of age and get pneumatized when you are kind of an adult. So usually you won't get frontal sinusitis in early age group. Mainly it's adults. So when we are talking about sinus infection in the kids, we are talking about only most of the time two sinuses. One is ethmoid and other is a maxillary sinusitis. As I said, maxillary sinuses get developed by 6 to 7 years of age. So there is a less possibility that you can have a maxillary sinus infection, which is here, early age group. Ethmoid sinuses infection are quite rare, but yes, they can possible, and they can cause surrounding eye infection also, but they are rare. So first of all, about the question is when or how this sinus infection happens. So most of the sinus infections, you can say they are divided into acute and chronic. So acute infections are when you have when the sinus infection is there for less than 12 years, 12 weeks. That means less than 3 months of infection, we call it a acute sinus infection. And most of the kids have acute sinus infection, which is lasting for 7 to 12 days, or most of the time it would be 2 weeks. Chronic sinus infections are when the infection is crossing more than 12 weeks. That means they are there. The infection is there inside the sinuses for more than 12 weeks. Then we say chronic sinusitis. And very rarely you see chronic sinusitis in the early age group. Chronic sinusitis usually you see in the kids with allergic tendencies or who had some developmental malformation. We'll talk about it. So let's talk about acute sinusitis. As I told you, it's mainly related to the ethmoid and maxillary sinuses. Most of this, what are the symptoms? Why they develop this? What are the symptoms? So what happens? This kind of a draining pouch, and it is connected with the nose through small opening. And this, though it is a kind of a bone with the air, it is lined with some kind of a mucosa or a tissue, you can say soft tissue, and there is a small opening. Through that they get aerated, so the air comes in, goes out, comes in, goes out. And there is some secretions because this mucosa also secretes some secretions. So if this kind of an opening or small pipe through which it is communicating with the nose, it gets blocked. So what will happen? The bad air will stay inside, there will be no aeration. Second thing, there are secretions happening inside the the sinuses, they stay there and they get secondarily infected, and then you start getting some symptoms related to sinuses. So most of the time, this acute sinusitis are associated with upper respiratory tract infection. That means you can have infection of the nose, we call it a rhinitis. You can have infection of the throat, I would say throat infection or sore throat. Uh, we call it upper respiratory tract infections. And then if they are not taken properly or they have a blockage of the aeration of the sinuses or pipes of the sinuses, they start getting sinusitis. And what happens in exactly in sinusitis is these pipes can be blocked because of the swelling of the mucosa or infection by per se. Second thing is secretions can block. And we know that whenever there is an inflammation or infection of the nose, the tissue gets swelled up or it becomes more red and it can get easily blocked. Similarly, what we see in the ear infection, last time we spoke about acute superiority otitis media, same thing. Here the pipe get blocked and the secretions which are staying inside, they don't get drained outside and there are very high chance that they get secondarily infected. So what are the symptoms? Most of these kids will have fever. Second thing, they will have cough and cold. They will have a runny nose. And slowly, what happens once they started getting more symptoms related of sinusitis, the secretion will become thicker, yellowish or greenish or foul smelling. And most of these kids can lose their smell sensation. They will feel heaviness in this area or head, and they will started having headache, and fever spikes will continue. These are the commonest symptoms which we see when we are thinking about a sinusitis. So, what are the kids who get sinusitis or this kind of an acute sinusitis infections are? Mainly kids who had adenoids, those kids who are having allergic tendencies, those kids who are having immunodeficiency, that means they don't have power to fight with the infections since early age group, those who are having some kind of I would say, deviation of the nasal septum, or sometimes it's a turbinates. Actually, turbinates are some mucosal part present inside the nose. They are hypertrophic because of the chronic infections. And if you won't take care of the upper respiratory tract infection properly, these are the kids who are having higher chances of getting infection. But as I told you, very unlikely you will have maxillary infection in 2 to 3 years of age. Usually, this infection comes by 5 to 6 years of age when there is a pneumatization of the maxillary sinuses. Sometimes you can have a swelling of the maxillary sinuses and they start feeling the pain. So as we said, like you will have upper respiratory tract infection symptoms, and associated the symptoms will keep on going, and you start having a new symptoms in the form of a swelling, headache, continuous secretions, bad secretions, loss of smell, headache. So then you should think about that. This is not simple upper respiratory tract infection. We started having some features of sinusitis. So once you come to the doctor and you show them that this is the symptoms presenting, we do some certain examination in the form of checking the nose, whether the nose inside is red, how is the consistency of secretion, they are bad, smelly, yellow. And then sometimes we can get a tenderness by pressing on this area. So if you press and the child is wincing, that means definitely there is a sinus inflammation. And very unlikely, this is most of the time clinical diagnosis, and sometimes we get an X-ray done. In the X-ray, we see haziness because this is an air. We should see a blackish spot when we are doing a chest X-ray. But if it is hazy completely, that means we are dealing with the sinusitis. Then we search for other additional things which will tell us that why this child had a sinusitis. So we check for developmental malformation, adenoid hyperplasia, tonsillar hyperplasia, chronic sinusitis, terminate hypertrophy, immunodeficiency. And then we come to the conclusion the child is suffering from sinusitis. So how to help these kids once they come? Once we diagnose this, we do. Remember, 70% of the sinusitis still are viral. So it's not like that every sinusitis needs antibiotics. So still viral. So how, when we are suspecting the viral sinusitis, what is the treatment? So the treatment remains the same. What we have to do, we have to make it sure that there is an adequate drainage of the fluid which is accumulated into the sinuses through the nose. So you can ask kids about nose clearing exercises, a little bit of blowing, not forcefully, and we make it sure that we are asking them to blow one nostril at one point of time, not both the nostrils, because it can significantly increase the pressure and the infection can actually traverse in a reverse direction. That's one thing. Second thing is using frequent nasoclears. What happens with the nasoclear is secretions, that these are the saline drop. The secretions become thin and they can come out easily. Third thing is warm humidity, or sometimes steam inhalation helps. What happens with the steam inhalations is it's a warm humidity. It decreases the swelling of the mucosa, and it promotes the aeration of the sinuses. So that is something, if it is possible and the child is comfortable in taking steam inhalation and been trained adequately, you can try this steam inhalation, which will be very helpful. Third thing is we give some medications to take care of this. What are these medications? We give some medications to take care of the pain. Second thing is we know that there is a lot of congestion and there is a swelling of the tissue. So we give some medications to make it sure that the congestion is less and there is an adequate drainage of the that is sinuses into the nose, so that the infection get decreased. Third thing is, in a 30 to 40% of these kids, they require antibiotics. And remember, in this condition also, we have to make it sure that we are not giving antibiotics for like 3 days, 4 days, 5 days. Most of this patient requires antibiotics from 7 to 10 days because of the deepness of the infection and appropriate doses. And when we are start antibiotics, a lot of times what we do, we get this bad secretion which are coming from the nose, get it cultured to identify what kind of an organism is causing this infection. Coming to the organism, there are mainly three organisms or microorganisms which causes this infection. It's Streptococcus, you have a Staphylococcus and Moraxella catarrhalis. Moraxella catarrhalis is usually seen in the older age group, and most of the kid we see Streptococcus and Staphylococcus. And these are the organisms we should identify, we should get a culture done to know the appropriate duration and appropriate choice of an antibiotics. And usually, as I told you, we continue antibiotic for 7 to 10 days. We give painkillers, we make it sure that the congestion is less. And with the slow kind of a things, the things started improving. And how we see that the child is improving. So the fullness of the sinuses goes down, the headache goes down, fever comes down, the secretions become less thick, the color changes, they become a little bit more whitish, and there will be an easy drainage of the secretions. Then you started feeling much better. You can see that air going in and the fullness is less. So these are the symptoms when we feel that the sinus infection is improving. Very rarely, because of the sinusitis, you have to actually go to the hospital and get admitted. Most of the sinusitis are treated on the OPD basis. But remember, the sinuses are very important. If you won't take care of them, I have seen a lot of patients who get a very bad sinus infection, ethmoid as well as maxillary, and they get associated eye infections. We call it an orbital cellulitis, which is not actually a good infection. So we have to make it sure that we are taking care of this infection properly. Now, there are actually those kids who get an acute sinusitis. Approximately, there is a chance that 20 to 30% of these kids can get a chronic sinusitis. What is chronic sinusitis mean? The same features are persisting for more than 12 weeks. And what are the symptoms? They keep on having some headache. They will have this fullness of the face, or they will feel the head is very heavy. Fever, intermittent fever, nasal secretion to keep on coming. They will feel nose is blocked, one nostril is boxed, and one part of the face is looking more heavy. So these symptoms keep on going, and they can have intermittent acute episode of sinusitis on the chronic sinusitis. And these are the patients we have to make it sure that we have to rule out definitely different allergies. Second thing is a developmental malformation, that the nose is not properly, I would say, made or been there. There is a deviated septum, there is a terminate hypertrophy, adenoid hyperplasia. So we have to treat these symptoms also, or treat these diseases. If you just keep on targeting the sinusitis, it might not help in this kind of a patient. Then chronic sinusitis, we have to make it sure that the continuation of treatment is there. A lot of this patient might require some nasal steroid so that the inflammation is less. It will help these sinuses to drain properly. Second thing, it might take care of the associated thing like allergic sinusitis. Third thing is adenoid hyperplasia. And we do continue this for probably around 2 to 3 months. And once the symptoms have been taken care of, slowly we withdraw it. So these are mainly things about acute and chronic sinusitis. But yes, we have to make it sure that we are taking care of it because, as I told you, a lot of this infection can cause multiple issues in the form of infection all around the places. So with this, probably we'll take some questions. I'll just go on the link to see whether there are questions. No, we'll see some questions. There will be questions. There are no questions. We'll wait for 2-3 minutes. So, what about prevention of this sinuses infection? So, what happens in exactly you have to make it sure that whenever your kid is having a good respiratory tract infection or upper respiratory tract infection, you give an adequate attention to that in the form of that symptoms are not prolonging for more than 7 to 10 days. You have to keep on watching how is this nasal secretions, are they becoming very yellow, greenish, or there's a foul smell. A child is not able to smell the common things, then you should have a suspicion that something is wrong. Second thing is they start feeling fullness of the face or headache comes into the picture, and they might sometimes feel some swelling all over the sinuses region. A lot of times they can have a bad mouth odor also. So these are the times we should be suspicious that the child might be having some sinus infection. So you try to identify the upper tract infection early, try to take care of it as soon as possible, and make it sure that there is no nidus or there is no associated things which actually give rise to acute sinusitis. And lot of times breathing exercises, deep breathing exercises, nose cleaning exercises is helpful because it promotes the aeration of the sinuses. And if there is an air inside the sinuses, unlikely it will get blocked and cause sinus infection. Making sure that those kids who had some developmental malformation in the form of deviated nasal septum, other associated allergies, chronic sinusitis or rhinosinusitis, making sure that they are actually adequately hydrated, they have less like their treatment is going on, like iodine hyperplasia has been taken care of, and they are having a warm humidity. They are frequently taking the nasoclear drop, which itself is not medications. And remember that 60% of them are viral, 60 to 70% they don't require medication, they don't require antibiotics, they require supportive medication, and the things get settled down over the time. Sometimes some kids might just consider that there is a fullness and headache because they don't have uh, frank features in the form of nasal discharge. They might not have, I would say, uh, fever. There will be subtle kind of a features, and they will complain of there is a headache, and their vision examination is normal. So that can be also a feature of chronic sinusitis. So keep that in mind. Those kids who are having snoring a little bit, that could be a feature of adenoid hyperplasia, and these kids keep on having some headache. So, of adenoid hyperplasia causing the sinusitis, chronic sinusitis, head fullness, and sinus infection. So, these are the few things you keep it in the mind when you're thinking about or what is your child is having related to the sinuses. Very unlikely these kids requires IV antibiotics. Most of them get treated with oral antibiotics and some decongestive measures and warm immunity, as I told you. If there are no questions, we'll stop, sir. We are off.